Good evening. Welcome to Viewpoint. I'm Zakir Jacob. The biggest crisis in this second wave of corona seems to be the lack of availability of oxygen. How did things come to such a pass that in big cities like Delhi, Mumbai, Lucknow, etc., people were literally gasping for breath? Could the centre and states have been better prepared? After all, India is one of the world's largest producers of medical grade oxygen. So, what exactly went wrong? And more importantly, what can be done in the next few days to make sure that no one in this country has to go without oxygen? So what's the solution? As the oxygen crisis continues, the centre has now stepped in with measures to boost medical oxygen supply. Over 500 PSA oxygen plants will be funded via PM CARES at the public healthcare facilities across the country. The Ministry of Home Affairs has also directed all manufacturers of medical oxygen to use liquid oxygen only for medical purposes and not for industrial purposes. States too have been asked to curb the use of liquid oxygen for any non-medical purpose. Meanwhile, the first Oxygen Express train for Delhi carrying 70 tons of oxygen from the Jindal Steel plant in Raigad will reach the capital later tonight. C-17 aircraft of the Indian Air Force have also been deployed to airlift empty cryogenic containers to filling stations in Jamnagar in Gujarat. So how did things reach such a critical pass, and what needs to be done over the next few days, perhaps a week, because this period seems to be critical? Dr. Rahul Pandit is Director of Critical Care at Fortis Hospitals, Mumbai, and a member of the Maharashtra COVID Task Force. Dr. Ajay Kumar is Chairman of the PLK Hospital here in Delhi. Dr. Shashank Joshi, member of the Maharashtra COVID Task Force and consultant endocrinologist at the Lilavati Hospital in Mumbai. And Dr. Vishal Rao is Dean at the Centre for Academic Research at the HCG Cancer Centre and a member of the COVID Task Force in Karnataka. I'll start with you, Dr. Kumar, Dr. Ajay Kumar, because over the last 3-4 days, whether it's on social media feeds, whether it's on TV channels, on WhatsApp groups, people have been asking other people only for oxygen cylinders or oxygen beds. How did things come to such a pass that, hospitals had to either resort to social media, or some hospitals in Delhi had to even approach the High Court to gain access to oxygen? How did this happen despite the fact that India is one of the largest producers of oxygen anywhere in the world?
Well, what you said is absolutely right. The things have turned really bad and so in the last week. People are really gasping for oxygen. We as a practicing doctors are flooded with calls altogether, only on one request, please get us a oxygen bed. So the fact is right, that is a very critical situation. At the same time, why it has reached this? Obviously, there has been some lack of communication, miscommunication, or there is planning, whatever it is. I'm not in a position to go into the details of that. But what is important is to find a solution. And whatever we are hearing over the last 3 to 4 days, not only hearing, we are seeing the differences in the activities have started to by the industrialists, by the government, by the trains, by the air force. So from all sides together.
Yeah.
What it requires now is a more coordination, better coordination at the ground level. I'm pretty confident that within the next 48 hours, things will be in the right channel. The
Okay.
only thing is, I just want to add one line. This is high time that our political friends stop blaming each other or blaming one or the other for this. start working on it.
Okay, fair point. Let me ask Dr. Shashank Joshi, because he had put out a tweet a few hours back, and this is one of the silver linings in these dark clouds. In Mumbai, for example, the number of cases per day now has come down to below 4,000. I think it's the first time that's happened in a number of weeks. Are you also hearing similar reports of people wanting oxygen in Mumbai? Because it seems to be most of these cases are happening in Delhi or in Lucknow or some of the other cities, not so much in Mumbai, even though the caseload is quite high, but it's coming down over the last few days, particularly in the last week.
Very true. Couple of weeks back, we did have scrambling for oxygen. Not anymore. I think now things are easing up, but still we are, not at all complacent. Yesterday was a Sunday, so the number of tests were 41,000. The number is still less. We are clearly flattening or probably showing a downward trend. So the downward slope has clearly started. Our test positivity rate also from almost 28-30% in the first week of April is now down to around 13 to 14% or 16%. All these are welcome signs. Our case fatality rate is only 0.04, which is one of the lowest in the world now. So clearly, we were stretched. We are still stretched. I would not say that we are out of the woods still. Our private infrastructure and public infrastructure, particularly the private infrastructure, is still under a lot of stress, and we are still trying to build up more and more capacities. You know that Mumbai Municipal Corporation has added 4 jumbos. They are adding another 4,000 beds. So the war is still on, but definitely we are seeing a little better signs of relief, and we are still trying to mobilize oxygen. We are still having intermittent places where oxygen are not there, because a large volume of patients or the active caseload is pretty large even today in the city of Mumbai, and therefore we need to be very mindful of that. That a lot of oxygen is still necessary and is being mobilized from both central and state government. And I think right now we are a little breathing a little easier on the need for oxygen or need for medications compared to what we were maybe a week or 15 days back.
Dr. Pandit, one of the things that people have been curious about is, particularly when it comes to private hospitals, before the COVID situation and before the last few weeks, let's say the last month, where there was this sudden explosion of the need for oxygen, it would always be that hospitals directly, coordinate with suppliers, and then whatever the requirement is, it's sorted out between the supplier and the hospital. This time around, and this has been so curious because there's a back and forth, whose responsibility is it? Is it the responsibility of the central government? Is it the responsibility of the state governments? Because again, what we're seeing is, the two sets of governments are simply passing the buck. Today we had this classic situation in the High Court where the central government, one of the suppliers, in fact one of the largest suppliers, said, who do I listen to? Do I listen to the central government or do I listen to the state governments?
Look, I think we need to be very clear as to that oxygen deficiency, and to try and restore the oxygen flows in the hospitals is going to require a multi-pronged approach. One of the approach obviously is to try and increase the availability of oxygen. The other aspect of that is also to use or utilize oxygen in a very judicious way. And while you are right that there may be some confusions about oxygen suppliers, who do they listen to, I think that's more to be sorted out at the administrative level, and that probably is happening quite a reasonable way in Maharashtra, at least right now. And other states would also follow very quickly, I believe so. I don't think people are actually going to play a lot of problems in terms of availability of oxygen. They would sort out and come up to a common terms to bring the oxygen to the hospitals. Other thing which I want to emphasize is that Dr. Joshi said that we are now a bit better. But remember, the patients who have admitted a week before now are probably going to be sick enough to require oxygen. So I think this another week is going to be very crucial for Maharashtra and Mumbai. Even if the numbers start decreasing down from here on, we are still probably going to have a week or 10 days, which will be very, very crucial for oxygen. And judicious use of oxygen, we've actually sent out some guidelines from Maharashtra Task Force, which me and Dr. Joshi, both of us have authored that, about how to sort of change the targets for hospitalized patients, how to promote patients to lie down prone. Just by lying down on their stomach, they can actually increase oxygen saturation by a percentage or two, and thereby we could save every liter saved is actually every liter going into our reserves, which will actually help us to save the oxygen at larger level. Secondly, we also need to change our oxygen targets from being targeting 97 to 100%. We just need to bring it down to say 90 to 95%, for hospitalized patients. I'm very clear for hospitalized patients.
Okay.
Patients who are at home, their targets or red flags are still the same. They need to present to a hospital if the saturation drops below 93%.
Okay.
But for hospitalized patients under supervision, we can bring down the targets a little bit lower. For patients in ICU, the target could be a little bit even lower than that. It could be between 90 and 93%.
Okay.
Thereby, we could save some oxygen, and ultimately, if everybody follow the standard practice, and there is good evidence for all of this, what I'm saying in medical books, in research, which has been published in the last few years, that you don't need to have a concentration of oxygen in the blood at around 100% saturation. You can
Okay.
bring it down safely in a
I
monitored environment.
also want to ask Dr. Vishal Rao, one of the recurring questions as Karnataka has decided to go into a 14-day lockdown starting tonight, one of the recurring questions people are asking us is, how do I set up an oxygen cylinder at home? How do I set up an oxygen concentrator at home? Is it safe? Because one of the problems seems to be that a lot of people are rushing to hospital. As Dr. Pandit said, a lot of people are rushing to hospital the moment you're at 95, 94, when many of them can be taken care of at home. Is that advisable given the stretch on the hospital infrastructure that we're seeing across the country? Dr. Rao?
Absolutely. I think this is a very pertinent point at which we need to segregate and understand a lot of this war can be won at home. Especially home oxygen therapy. Now, a lot of new international guidelines have come in to actually guide us on how we can effectively be using oxygen at home and help people recover who are low risk. Now, there is definitely a need to identify who are the high-risk people who are going to worsen on oxygen, and they are the ones whom we need to preciously preserve the beds in the hospital for giving high-flow oxygen or for giving continuous oxygen with monitoring. And thereafter, I think the losing battle starts with ICUs. So I think we need to clearly segregate and I think the state government of Karnataka, along with the COVID task force, has created a very stringent, clear, demarcated guidelines on how we can make this happen, and where do we use an oxygen concentrator, where do we use hospital with oxygen, and where ICU criteria begin. It's very crucial to address this at a very clear scientific level. I also want to point out, since I was hearing the discussion, that we need to also understand that there is a difference between population mortality and hospital mortality. We are all talking about a good number. There is very less mortality. It can be 1% or 1.5%. But when it goes to hospitals, the mortality changes. It can go as high as 10 to 15%. This is a very important consideration. And lastly, I think the larger debate here is also about not just about oxygen, but also about steel and other industries which are non-medical, where the source of oxygen comes from, and a lot of oxygen suppliers themselves are gasping because of that.
I want to go back to Dr. Kumar and ask him, if we were to see through the next 15 days, clearly in Mumbai, the case curve is coming down, and we are all keeping our fingers crossed that this is a pattern and this continues over the next week, 10 days. In Delhi and in Bangalore, for example, the opposite is happening. The caseload is still very high on a daily basis. How do we begin to sort of flatten the curve, if not, change the direction of that curve? How do we bring down the number of people who are being infected on a daily basis?
Well, I think that's the most important issue. Of course, oxygen and beds are important for the immediate handling. How to take care of the future? I think we go back to our basic things. That is the mask and a proper use, a strict enforcement of mask in public places. Absolutely no restrictions, no laxity on that. You may have to use harsh means to do that, but the most important thing is a self-discipline by the public. Social distancing, very important. And of course, sanitization. I will put the mask thing is such a bad thing that we have been more than 1 year through this. But today also, when my patient enters my chamber, they will put the mask down and say, Doctor Sahab, bolne ke liye niche kar rahe. As if you cannot get your voice across. I mean, today also, I'm sitting in the outpatient, this is what we face. And it actually irritates that why can we, and these are educated people. These are not illiterate. So I think that is the most important thing, and for that, media has to play an important role to publicize it. I know you're doing quite a lot, but I think we need a more efforts for medical people, for the society leaders to come out and speak in favor of that. And I just want to, Zaka, point out one issue while we are discussing on these issues. What I am worried about, that I'm sure that we will take care of the problem of oxygen and the beds over the next week or so. And I'm also sure that the graph will come down following Mumbai, good signals from Mumbai. And over the next 2 weeks, that should also show a good response. But I am worried about the medical force. The human resources, they're at its absolutely wit's end. They're fatigued, and we are really running short. I think we need to think of alternate means. And everybody may not sound by that, but what I mean by that, that for a particular center or the particular care center and the second, even in oxygen centers, if you can train the volunteers to how to intelligently monitor and use the oxygen and to identify the trigger factors when the alarm has to be raised, I think it's very important that if you are ready for the next 2 months, we
Okay.
need to do that.
All right, let me go back to Dr. Joshi. Today, for example, in the Health Ministry's briefing, one of the things that was suggested by Dr. V.K. Paul is that one of the signs that we've noticed is one member in the family contracts it, and then suddenly 3, 4, 5 members in the family suddenly contract it. So the government is today saying that it's come to a stage where you have to wear a mask even if you're inside your house. How does that change our understanding of the disease and the way this current wave is spreading?
Zaka, in this way, it is very clear. It's a fast, rapidly spreading strain, and there is a clustering of families. So, formally, in a family of 10, if 3 got infected, all 10 get infected now. And that is the more transmissible strain which we are seeing. And this is a consistent pattern which is observed, and which is why Dr. Vinod Paul sir has very clearly said that mask even at home and break the chain of transmission. It's absolutely mandatory. In fact, we have been advocating double masking, me and Dr. Pandit, for almost 2 months now, because the best vaccine, whether you have mutants, no mutants, whether you have variants of concern, no variants of concern, double masking is mandatory. And if there is an index case at home, then obviously it is important that the family members also wear a double mask, even if there is isolation, because you need to be cautious. We are also understanding a little better about the mode of transmission. Just a year back in March, WHO thought this is not even airborne droplet. And now there is a lot of research going on from aerosol scientists stating that beyond airborne droplet, it could also be airborne. But clearly we know that there is definitely an aerial route of transmission. And whenever there is an aerosolized droplet, which is going to be there, the best protection we have is to have appropriate fitting mask. So if you are having a cloth mask, that may not be sufficient to protect you. And therefore, you probably may wear a 3-ply surgical mask, which is 2 rupees, and then cover it up with a tightly fitting cloth mask. And that is very, very crucial to break the chain. See, ultimately, we have to break the chain. And whether this wave will come and go, we will have to break the chain in the community. We clearly have this in the community now. And if we are having it in the community, we clearly need to break the chain. And we will have to follow this behavior all throughout the year, even after vaccination.
No, I get that. I want to get a final word from Dr. Pandit. If that is true, that this is now in the air, an aerosol transmission, and it's literally in our living rooms, what does one do? Because earlier, we would sanitize doorknobs and door handles and tables and chairs and so on. But if this is spreading through the air and through aerosol transmission, what does one do, for example, inside a house to sanitize the air inside the house?
So if you have a suspected patient in your house, that's when you need to be absolutely clear that you need to double mask.
Okay.
And you need to be very, very clear about that your air may also be contaminated, because what happens is that when the droplets fall down and they dry up, and if you suppose put on a ceiling fan, and the air circulates, that's when these virus particles are actually going to be circulating. That's the theory behind it, that it actually gets blown up by the air possibly. But normal circumstances, it is best that you actually maintain a social distance within the family as well. If there is anybody who is of slightest suspicion, one has to be very, very clear that we have to be having a responsibility towards our own family member. If I have a symptom, you've got to stay in another room if that's possible. If that's not possible, everybody else wears a mask and try and stay away from the family as much as you can. Go and test yourself,
Okay.
make sure that you are negative, and only then come back into the family. And that to possibly stay 14 days away. I think that's what we have been doing. I mean, as a doctor, me and Dr. Doshi, we've been staying in a different room for the last 1.5 years now from the family.
Yeah.
That's just the way of life for us now.
All right. Thank you very much, doctors. Again, once again, salute to all your efforts. Frankly, this one thing that stands out in the second wave amidst all this doom and gloom is the effort that doctors like yourselves are putting. And may God give you the strength and the wisdom and the patience to deal with it, because clearly we are, in the midst of this second wave, and it is going to last a few weeks. And of course, the other thing that we're seeing through social media and family groups and friends groups and all that is how people are helping each other out. I want to thank all our guests for joining us. Let's try, and because there's been a lot of intense focus and scrutiny even internationally about the second wave that's happening right now here in India. But this is not something that's happened in isolation. The US, the UK, other foreign countries have seen this second wave a few months ago. So I'm now joined by Dr. Ashish Jha, who's Dean at the Brown University. Thanks very much, Dr. Jha, for speaking with us. You're aware of this. The international press is talking about India being in the midst of the second wave. Medically speaking, what particular things stand out for you in this second wave?
Yeah, so obviously things are very, very bad right now. I will say a few things. One is I think things are likely to get worse before they get better. I don't think India is at its peak yet. It's going to probably continue. Infection numbers are going to continue rising. We don't know how much the variants are playing a role. They may be playing some role. Part of the problem here is that there is not enough genomic surveillance happening. We can't quite tell to what extent variants are driving the spread. And then, of course, what's very different about this wave is that it has really caused a massive strain on the healthcare system of India in so many different ways, running out of beds, running out of oxygen, running out of medicines. So I think things are quite difficult right now, and we really need to pull things together to try to get through the next few weeks.
You talked about these new strains, these variants. There is some amount of research about this Indian strain, or a double mutant as it's being called, the B1617, the way it attacks the human body. What is different about these strains that we're seeing in terms of transmissibility of the virus, and also the population that's being affected by it?
I will say two things. I mean, first of all, I think B1671, the variant that is circulating, we don't know to what extent it is because the variant is different that is driving the spread. I want to emphasize that it's easy to think it's all because of this variant. We don't know that. We do know that in many places in India, B117, the variant originally from the UK, is also quite prevalent. There is some evidence that this 1671 may be more deadly, as well as B117, that it may cause more severe illness, may cause more severe illness in young people. That may be one of the reasons we're seeing so many young people in their 20s and 30s get very sick and die. There's a lot to sort out here. But the biggest thing we have to do is we have to stop the spread of this virus and sort out how much of the variants are causing these things, because things are in quite dire shape, and they will be for a little bit longer.
Even in terms of the symptoms that we're seeing in this wave, unlike in the first one, where a sore throat or persistent dry cough seem to be classic symptoms in the first wave. In this case, we are seeing a lot of people whose lungs are getting directly affected, and suddenly within a matter of hours, maybe even a day or so, they are having to be taken to hospital for oxygen.
Yeah, I think, again, there is some evidence that these strains that are circulating in India are more severe. They cause what people talk about as a higher viral load, just so you have more virus, and therefore it will cause more damage to the lungs. And I think that's definitely a part of what's going on and why the number of people getting very sick and dying is increasing so rapidly.
And one final word, there's about 14 crore people who've been vaccinated already. It's about 140 million across, either first dose or both. There have been instances, quite a few instances, of people who've been infected by this virus even after the first dose, and quite a few cases of people who've been infected after taking both the doses. Is that normal?
Yeah, so look, India has vaccinated, a lot of people, and we don't expect these vaccines to be 100%. So you're gonna see a small number of breakthrough infections, certainly after the first dose. Even after the second dose, you're gonna see a small number. The problem right now is all the data I'm looking at suggests that is exactly what you would expect. That while the vaccines are 80, 90% effective at reducing infections, they're not 100%. And so when you vaccinate tens of millions of people, you're going to see hundreds, maybe thousands of people getting infected after the vaccine. It's tiny compared to what would have happened if we had not vaccinated all those people. But this is to be expected. And we've seen this everywhere in the world, that a small proportion of people still get infected after the vaccine.
All right, Dr. Ashish Jha, as always, pleasure speaking with you. Thank you very much.